What if that persistent itch you've been ignoring is actually your body's desperate attempt to warn you about a serious health condition? Imagine discovering that the minor discomfort you've dismissed for months was actually an early signal of diabetes, liver disease, or even cancer. For Elizabeth, a vibrant 72-year-old grandmother, this wasn't just a hypothetical scenario. It was a reality that may have saved her life. After months of brushing off an unusual itching sensation on her breast as simply dry skin, she finally mentioned it to her doctor. What followed was a diagnosis of inflammatory breast cancer, caught early enough to treat successfully. "If I had waited even 2 more months," Elizabeth later shared, "my story might have had a very different ending." Today, we're diving deep into the hidden language your body speaks, a language that becomes increasingly important to understand as you age. I'll reveal 7 critical warning signs that seniors often dismiss but should never ignore. These aren't just random symptoms. They're your body's alarm system, alerting you to potential dangers before they become life-threatening emergencies. By watching until the end of this video, you'll learn exactly which sensations deserve immediate medical attention, which can wait, and how to tell the difference. You'll discover what specific types of itching, pain, and discomfort might be telling you about your health, and the precise steps to take when your body sounds these alarms. This isn't about becoming anxious over every minor symptom. It's about gaining the wisdom to recognize when your body is truly trying to alert you to something serious. Have you ever wondered if that strange sensation you occasionally feel might be more than just an ordinary discomfort? Or perhaps you've noticed a loved one dismissing symptoms that seem concerning to you. Stay with me, because the information in this video could be the difference between catching a health problem early when it's most treatable, or facing a crisis that could have been prevented. Let's begin by exploring our first warning sign: persistent itching in specific body areas. This seemingly minor irritation could be signaling major health concerns that you should never ignore. The first warning sign we need to discuss is persistent itching, particularly when it's focused in certain areas of your body. While occasional itchiness is normal and usually harmless, chronic or intense itching that doesn't respond to simple remedies might be your body's way of alerting you to something more serious beneath the surface. Let's start with itchy hands and feet, a sensation many seniors experience and often attribute simply to dry skin. While dry skin is certainly a common cause, persistent itching in these extremities, especially when accompanied by tingling, numbness, or burning, could be signaling peripheral neuropathy, a condition often associated with diabetes. When diabetes develops or worsens, high blood sugar levels can damage the small nerve fibers in your extremities. This nerve damage manifests as itching, tingling, or pain, often starting in the feet and sometimes extending to the hands. What makes this particularly concerning is that many people have undiagnosed diabetes or prediabetes without realizing it. According to the CDC, over 7 million Americans have undiagnosed diabetes, and many first learn of their condition only after nerve damage has already begun. Consider the experience of Robert, a 68-year-old retired construction worker who noticed persistent itching on the soles of his feet for months. "I tried every lotion and cream on the market," he recalls. "I even changed my laundry detergent, thinking it might be an allergic reaction. It wasn't until I mentioned it during a routine checkup that my doctor suggested testing my blood sugar." The test revealed that Robert had been living with undiagnosed type 2 diabetes, with blood sugar levels high enough to cause nerve damage. But diabetes isn't the only serious condition that can manifest as itchy extremities. Chronic kidney disease often causes itching in the hands and feet due to mineral imbalances and buildup of waste products in the blood. As kidney function declines, the body cannot properly filter waste, leading to itching that many patients describe as deep, persistent, and particularly intense at night. Similarly, certain liver disorders, particularly primary biliary cholangitis and other conditions causing bile duct obstruction, often first appear as itching in the palms and soles. This itching occurs because bile salts, which normally would be processed and eliminated by a healthy liver, accumulate in the skin when liver function is compromised. What makes these connections particularly important for seniors is that diabetes, kidney disease, and liver disorders all become more common with age, yet their early symptoms can be subtle and easy to dismiss. By the time more obvious symptoms appear, like extreme thirst and frequent urination with diabetes, or yellowing of the skin with liver disease, the condition may have progressed significantly. If you've been experiencing persistent itching in your hands or feet that doesn't improve with moisturizers or antihistamines, especially if it's accompanied by changes in skin color, texture, or sensation, it's crucial to consult with your healthcare provider. A simple blood test can screen for diabetes, kidney dysfunction, or liver abnormalities, potentially catching these serious conditions in their early, more treatable stages. Are you experiencing unexplained itching in your hands or feet? Has it persisted despite trying over-the-counter remedies? These might be questions worth discussing with your doctor at your next visit. Remember, your body often whispers before it screams, and learning to listen to these subtle signals is a crucial part of maintaining your health as you age. If you're finding value in understanding these warning signs, please type "signals" in the comments below to let me know you're with me. Now, let's move on to our second warning sign. Our second critical warning sign is itchy skin around the eyes and face, particularly when it's persistent and not clearly related to allergies or skin conditions. This type of itching, especially when accompanied by yellowing of the whites of the eyes, could be signaling liver distress, a condition that becomes increasingly common as we age. The connection between eye itchiness and liver function has roots in both modern medicine and traditional healing systems. In traditional Chinese medicine, the liver and eyes have been considered intimately connected for thousands of years, with liver imbalances often manifesting first as eye-related symptoms. Modern research has validated this connection, showing how liver dysfunction can affect multiple aspects of eye health. When the liver isn't functioning properly, its ability to filter toxins from the bloodstream becomes compromised. Bilirubin, a yellow compound produced during the normal breakdown of red blood cells, normally gets processed by the liver and excreted through bile. When liver function is impaired, bilirubin levels in the blood increase, eventually depositing in the skin and the whites of the eyes, causing jaundice. Before jaundice becomes visible, however, rising levels of bilirubin and other toxins can irritate nerve endings in the delicate tissues around the eyes, resulting in itching that can range from mildly annoying to intensely distracting. This itching might be accompanied by other subtle symptoms: unusual fatigue, darkening urine, clay-colored stools, or mild abdominal discomfort. Margaret, an active 75-year-old who rarely missed her twice-weekly tennis games, began experiencing persistent itching around her eyes that she initially attributed to seasonal allergies. "I tried every allergy medication available," she explains, "but nothing helped. It wasn't until I noticed my eyes looking slightly yellow in a photograph that I decided to see my doctor." Blood tests revealed elevated liver enzymes, and further investigation uncovered an autoimmune liver condition that had been silently progressing. What's particularly concerning about liver-related itching is that it often appears before more obvious symptoms of liver disease. By the time jaundice becomes clearly visible or abdominal pain becomes significant, liver damage may already be extensive. In contrast, addressing liver issues when itching is the only symptom can lead to much better outcomes through earlier intervention. Several liver conditions common in seniors can cause this type of itching. Non-alcoholic fatty liver disease, NAFLD, which affects an estimated 30 to 40% of adults over 65 in the United States, often begins silently but can progress to inflammation and scarring if left unchecked. Primary biliary cholangitis, an autoimmune condition more common in women over 60, causes gradual destruction of the bile ducts in the liver, with itching often being one of the earliest symptoms. Medication-induced liver injury, a particular concern for seniors who typically take more prescriptions than younger adults, can develop gradually and might first manifest as itching around the eyes. Hepatitis C, which can remain dormant for decades before causing noticeable liver damage, affects a significant number of baby boomers who may have been exposed before the virus was identified and screening became routine. If you're experiencing unexplained itching around your eyes or face, particularly if it's accompanied by fatigue, digestive changes, or any yellowing of the skin or eyes, it's important to consult with your healthcare provider promptly. Simple blood tests can measure liver enzymes and function, potentially identifying liver issues before they become advanced. Have you noticed persistent itching around your eyes that doesn't seem related to allergies or skin irritation? Has this symptom been accompanied by unusual fatigue or changes in digestion? These observations could provide important clues about your liver health and deserve medical attention. Our third warning sign brings us to one of the most overlooked yet potentially serious symptoms: itching of the breast or chest area. While this symptom can have benign causes, persistent itching in the breast, particularly when accompanied by other changes, should never be dismissed, especially by women over 65, for whom breast cancer risk reaches its peak. Inflammatory breast cancer, IBC, a rare but aggressive form of breast cancer, often first presents with itching, redness, and skin changes rather than the lump most women are taught to look for. What makes this particularly dangerous is that these symptoms can easily be mistaken for infection, rash, or simple skin irritation, leading to critical delays in diagnosis. Unlike other forms of breast cancer, IBC tends to block lymph vessels in the skin of the breast, causing distinctive symptoms that can include persistent itching, redness that covers more than 1/3 of the breast, unusual warmth, skin that appears thickened with a texture similar to an orange peel, a condition called peau d'orange, and swelling that may cause asymmetry between the breasts. Carol, a 77-year-old retired nurse, experienced persistent itching on her right breast that she initially attributed to dry skin from swimming in her community pool. "Even with my medical background, I didn't make the connection," she admits. "It wasn't until I noticed the skin thickening and a slight redness that I became concerned." Her prompt action led to an early diagnosis of inflammatory breast cancer and successful treatment. What makes breast itching particularly important to monitor is that both IBC and other forms of breast cancer become more common with age, with the highest incidence occurring in women over 70. Yet many screening programs focus on younger women, and many seniors mistakenly believe they're no longer at risk once they reach advanced age. Beyond cancer, persistent breast itching can also signal Paget's disease of the breast, a rare condition that affects the nipple and usually signals an underlying breast cancer. Early symptoms often include itching, burning, or eczema-like changes to the nipple and areola that don't respond to typical skin treatments. If you experience persistent itching in the breast area, particularly if it's focused on one breast or accompanied by any visual or textural changes to the skin, it's vital to consult with your healthcare provider promptly. While these symptoms are more likely to have benign causes, the stakes of missing inflammatory breast cancer or Paget's disease are simply too high to justify a wait-and-see approach. Men, too, should be vigilant about chest itching, particularly when it affects one side more than the other. Though male breast cancer is rare, its incidence increases with age, and men often receive diagnoses at more advanced stages simply because the possibility isn't on their radar. Have you noticed any persistent itching in your chest or breast area? Has it been accompanied by skin changes, swelling, or asymmetry? These symptoms deserve prompt medical evaluation, regardless of your age or gender. If you're still with me and finding these insights valuable, please type "awareness" in the comments section. Your engagement helps me know I'm providing information that matters to you. The fourth warning sign we need to discuss is joint pain that occurs specifically at night or first thing in the morning. While many seniors experience some degree of joint discomfort, pain that consistently disturbs your sleep or causes significant stiffness upon waking could be signaling inflammatory conditions that require medical attention. Rheumatoid arthritis, RA, a chronic autoimmune condition, often announces itself through pain and stiffness that's worst in the early morning. What distinguishes RA from the more common osteoarthritis is this distinctive timing pattern, along with symmetrical involvement, affecting the same joint on both sides of the body, and pronounced stiffness that typically lasts more than 30 minutes after waking. This timing pattern occurs because inflammatory cytokines, the chemical messengers that drive joint inflammation in RA, reach their peak levels during the night and early morning. While you sleep, these inflammatory compounds accumulate in the joint fluid, causing the characteristic morning pain and stiffness that many RA patients describe as feeling locked up upon waking. James, a 71-year-old who had always enjoyed woodworking, began noticing that his hands were painfully stiff each morning. "At first, I thought it was just part of getting older," he recalls. "But when I couldn't even button my shirt or hold my coffee cup for the first hour after waking, I knew something more was happening." After consulting with his doctor, James was diagnosed with early-stage rheumatoid arthritis and began treatment that preserved his joint function and allowed him to continue his beloved hobby. While RA becomes more common with age, affecting approximately 2% of adults over 60, it's far from the only inflammatory condition that causes nighttime and morning joint pain. Polymyalgia rheumatica, PMR, which primarily affects adults over 65, causes pronounced pain and stiffness in the shoulders, neck, and hips that's typically worst in the morning. This condition often develops rapidly over a few weeks and can be accompanied by fatigue, low-grade fever, and weight loss. Similarly, crystal arthropathies like gout often trigger attacks during the night, with many patients reporting waking from sleep due to sudden, intense joint pain. Gout attacks frequently target the big toe, ankle, or knee, causing pain that patients often describe as feeling like the joint is on fire. What makes these inflammatory conditions particularly important to identify early is that many of them can cause permanent joint damage if left untreated. Modern treatments for conditions like RA can dramatically slow or even halt disease progression, but they work best when started early, before significant joint destruction has occurred. If you're experiencing joint pain that's consistently worse at night or upon waking, particularly if it's accompanied by noticeable swelling, redness, or prolonged morning stiffness, it's important to discuss these symptoms with your healthcare provider. Blood tests that measure inflammatory markers, along with clinical evaluation, can help distinguish between different types of arthritis and guide appropriate treatment. Have you noticed that your joint pain follows a pattern, being worse at certain times of day? Does morning stiffness significantly impact your ability to perform routine tasks after waking? These timing patterns provide valuable diagnostic clues that can help identify the specific condition affecting your joints. Our fifth warning sign is one that many seniors experience but rarely connect to serious health concerns: unexplained fatigue or weakness that doesn't improve with rest. While occasional tiredness is normal at any age, persistent fatigue that significantly impacts your daily activities could be signaling several conditions that become more common with advancing years. Anemia, a condition characterized by insufficient red blood cells or hemoglobin, affects approximately 10% of adults over 65 and becomes increasingly prevalent with age. While fatigue is the classic symptom of anemia, many seniors attribute this exhaustion to just getting older, rather than recognizing it as a specific medical condition that requires attention. What makes anemia particularly concerning for seniors is its diverse causes, each requiring different treatment approaches. Nutritional deficiencies, particularly of iron, vitamin B12, or folate, become more common with age due to dietary changes, decreased absorption, and medication interactions. Chronic conditions like kidney disease can reduce the production of erythropoietin, the hormone that stimulates red blood cell production. And occult bleeding, particularly from the gastrointestinal tract, can cause anemia that develops so gradually that its symptoms are easily missed or dismissed. Helen, an 83-year-old who had always been the energetic organizer of her community garden, found herself needing to sit down after just a few minutes of light activity. "I thought it was just my age catching up with me," she explains. "It wasn't until my daughter insisted on accompanying me to a checkup that we discovered my hemoglobin was dangerously low." Further investigation revealed silent bleeding from a gastric ulcer, a condition that was successfully treated once identified. Beyond anemia, unexplained fatigue may signal thyroid dysfunction, a condition that affects up to 10% of older adults, with subclinical hypothyroidism being particularly common. The thyroid gland regulates metabolism throughout the body, and when it produces insufficient hormones, every system slows down, resulting in fatigue, cold intolerance, constipation, and other symptoms that develop so gradually they're often attributed to normal aging. Heart failure, which affects approximately 10% of adults over 70, often first manifests as fatigue and exercise intolerance rather than the more dramatic symptoms people associate with heart problems. As the heart's pumping efficiency decreases, oxygen delivery to tissues becomes compromised, resulting in fatigue that's often most noticeable during physical activity but can progress to exhaustion even at rest. Even more concerning, fatigue is often the presenting symptom of certain cancers common in older adults, including leukemia, lymphoma, colon cancer, and stomach cancer. This fatigue results from the metabolic demands of the growing cancer, blood loss, and inflammatory responses, and may precede other more specific symptoms by months. If you're experiencing persistent fatigue that's new, worsening, or unimproved by adequate rest, particularly if it's accompanied by pallor, breathlessness, dizziness, or unintended weight loss, it's important to consult with your healthcare provider. Complete blood counts and other basic tests can identify many of the conditions that cause fatigue, potentially leading to treatments that restore your energy and protect your health. Have you noticed a significant decrease in your energy level that rest doesn't seem to improve? Does fatigue limit activities you previously enjoyed without difficulty? Rather than accepting these changes as inevitable aspects of aging, consider whether they might be signaling a specific condition that deserves medical attention. The sixth warning sign involves changes in your digestive system, particularly chronic constipation that's new or worsening. While occasional constipation affects people of all ages, persistent changes in bowel habits after age 65 should never be dismissed as simply an age-related inconvenience. As we age, several factors naturally predispose us to constipation. Decreased muscle tone in the digestive tract, reduced physical activity, changes in diet, and the effects of certain medications commonly prescribed to seniors. However, when constipation develops suddenly, worsens significantly, or doesn't respond to simple interventions like increased fluid intake and dietary fiber, it may signal more serious underlying conditions. Colorectal cancer, which becomes increasingly common after age 50, sometimes first presents as a change in bowel habits, particularly constipation. This occurs because growing tumors can partially obstruct the colon, making it difficult for stool to pass normally. While most cases of constipation are not caused by cancer, any new onset of constipation in older adults, especially when accompanied by other symptoms like blood in the stool, unintended weight loss, or abdominal pain, should prompt medical evaluation. Thomas, a 76-year-old retired accountant, noticed increasing difficulty with bowel movements over several months but attributed it to the pain medication he was taking for arthritis. "I just thought it was a side effect I had to live with," he recalls. "It wasn't until I saw some blood on the toilet paper that I mentioned it to my doctor." A colonoscopy revealed a tumor in his sigmoid colon that was caught early enough for successful surgical removal. Hypothyroidism, as mentioned earlier, commonly manifests as constipation due to the slowing of digestive motility when thyroid hormone levels are low. Since thyroid disorders become more prevalent with age and often develop gradually, the resulting constipation might be attributed to other factors, delaying proper diagnosis and treatment. Parkinson's disease, which affects approximately 1 to 2% of people over 65, often causes constipation years before the more recognizable symptoms like tremor and rigidity appear. This early constipation results from the same neural changes that eventually affect movement, impacting the autonomic nervous system that controls intestinal function. Even certain medications commonly prescribed to seniors can cause or worsen constipation, including calcium channel blockers for hypertension, opioid pain relievers, certain antidepressants, iron supplements, and some antacids. As the number of prescriptions typically increases with age, this medication-induced constipation becomes more common and can sometimes mask other underlying conditions. If you're experiencing new or worsening constipation, particularly if it's accompanied by other concerning symptoms like blood in the stool, abdominal pain, or unintended weight loss, it's important to consult with your healthcare provider rather than simply increasing fiber or trying over-the-counter laxatives. Proper evaluation may include blood tests to check thyroid function, colonoscopy to examine the colon directly, and a thorough review of your medications to identify potential contributors. Have you noticed significant changes in your bowel habits recently? Has constipation become more frequent or severe despite maintaining your usual diet and fluid intake? These changes deserve medical attention, particularly if they persist or worsen over time. If you're finding these insights valuable, please type "health" in the comments section. Now, let's move on to our seventh and final warning sign. Our seventh and final warning sign is one that many seniors and their families notice but often misinterpret. Significant mood or personality changes, particularly increasing apathy, withdrawal, or irritability. While it's common to attribute these changes to getting grumpy with age or adjusting to retirement, they can actually signal several serious health conditions that require medical attention. Depression affects approximately 7% of adults over 60 but is believed to be significantly underdiagnosed in this population. Unlike younger adults who often express depression through obvious sadness, older adults frequently experience depression as apathy, irritability, or somatic complaints like unexplained pain or digestive issues. Many seniors grew up in generations where mental health wasn't openly discussed, leading them to mask or deny emotional symptoms while focusing on physical complaints. What's particularly concerning is that late-life depression is associated with higher rates of physical decline, cognitive impairment, and mortality compared to depression earlier in life. Yet with proper treatment, which might include therapy, medication, lifestyle changes, or a combination of approaches, most seniors with depression experience significant improvement in both mood and overall functioning. Martha, an 80-year-old who had always been known for her cheerful disposition and active social life, gradually withdrew from community activities and began responding irritably to family members. "We all just thought she was tired of socializing and wanted more quiet time," her daughter explains. "It wasn't until she stopped calling her grandchildren, something she'd never missed doing weekly, that we realized something might be seriously wrong." After gentle encouragement to see her doctor, Martha was diagnosed with depression and began treatment that gradually restored her previous engagement and positive outlook. Beyond depression, significant mood or personality changes can signal early stages of dementia, including Alzheimer's disease. While memory loss is the symptom most associated with dementia, changes in personality, judgment, and social behavior often appear earlier in the disease process. A previously meticulous person becoming careless about appearance, a shy individual becoming inappropriately outgoing, or a patient person becoming easily agitated might all represent early signs of neurodegenerative changes. Even more acutely, dramatic personality changes can indicate serious medical emergencies like stroke, particularly when they occur suddenly. Strokes affecting the frontal lobe can cause personality changes, apathy, or inappropriate behavior that might be mistaken for psychiatric issues rather than recognized as the medical emergency they represent. Urinary tract infections, UTIs, which become more common and often present atypically in older adults, frequently manifest as sudden confusion, agitation, or personality changes rather than the typical symptoms of burning and frequent urination seen in younger people. This silent presentation of UTIs in seniors can lead to dangerous delays in treatment if the infection isn't recognized and addressed promptly. Medication side effects or interactions represent another common cause of mood and personality changes in seniors. As the number of prescriptions typically increases with age, so does the risk of adverse effects on cognition and mood. When a new medication is started or a dosage is changed shortly before personality changes begin, this connection should be investigated. If you notice significant changes in your own mood, interests, or typical behavior, or observe these changes in an older loved one, it's important to seek medical evaluation rather than assuming they represent a normal part of aging. A thorough assessment might include screening for depression, cognitive testing, review of medications, and laboratory tests to check for infections or metabolic abnormalities that could be affecting brain function. Have you noticed changes in your mood or personality that seem out of character for you? Have family members commented on differences in your behavior or outlook? These changes deserve attention and evaluation, as they may signal treatable conditions rather than inevitable aspects of aging. As we conclude our exploration of these 7 critical warning signs, I want to emphasize that growing older doesn't mean accepting discomfort, disability, or disease as inevitable. Many conditions that were once considered just part of getting older are now recognized as specific, often treatable health issues that shouldn't be dismissed or ignored. The key to maintaining health and independence in your senior years lies in becoming an active partner in your healthcare, observing changes in your body, communicating effectively with medical providers, and seeking timely evaluation when concerning symptoms arise. This isn't about becoming anxious over every minor discomfort, but rather about developing the wisdom to recognize when your body is sending important signals that deserve attention. Remember that early detection often leads to simpler, more effective treatment. Many conditions that can be managed easily when caught in their initial stages become significantly more difficult to treat once they've advanced or caused permanent damage. Your vigilance today could prevent a crisis tomorrow. If you're caring for an older loved one, encourage them to share health concerns rather than dismissing symptoms as just getting old. Many seniors minimize health changes due to fear, denial, or a desire not to burden others, but this well-intentioned stoicism can lead to missed opportunities for intervention and treatment. Which of these warning signs resonated most with you? Have you experienced any of these symptoms yourself, or noticed them in someone you care about? I'd love to hear your thoughts, questions, or experiences in the comments section below. Your perspective might help others recognize important symptoms they've been overlooking or encourage them to seek the medical attention they need. If you found this information valuable, please support our channel by clicking the like button, subscribing, and hitting the notification bell to stay updated on future videos about senior health and well-being. Your engagement helps us reach more people with information that could potentially save lives through earlier recognition of serious health conditions. Thank you for investing time in your health knowledge today. Remember, your body's whispers deserve attention before they become shouts. Here's to recognizing those early warning signs and enjoying the healthiest possible senior years.